Hello students, my name is Niyati Saeed and thanks for watching Edupedia word videos. My topic for the presentation is the 10th section of circulatory system, that is heart disorders. Okay, so we'll study here all the blood related disorders. Okay, have you ever thought what are the causes of heart diseases? First is aging. As people age, their cardiovascular system becomes very weaker. That means their cardiovascular system, it becomes weaker with the age. Okay. Second is genetics. The person may have a hereditary problem. That means a people who have direct family members that have had heart diseases are at the higher risk of developing it themselves. Another major cause of heart disease is lifestyle. Aspects of everyday life from work stress to lack of exercise and tension can increase the risk of heart diseases to many folds. Okay, tension is directly proportional to the heart diseases. Okay, smoking, as we know that cigarette has nicotine in it and the carbon monoxide, so these two increases the heart rate and thus it lowers the oxygen level in heart muscles and can cause thrombosis. Okay, another major cause of heart disease is diabetes. Hypertension and blood glucose can lead to angiosclerosis and thus it damages to tunica intima. Okay, another major cause is diet. Food rich in fat, cholesterol, salt, sugar, as well as food that contains alcohol, it increases the risk of angiosclerosis and atherosclerosis that can cause high blood pressure, because I have told you that more salt, that means Na plus ions, it deposits on the arteries and it retains the water also. Okay, and thus it makes the elasticity of the arteries very low. Okay, and that's what that condition is known as atherosclerosis. So these are the causes of heart diseases. Men are 3 to 5 times more likely to develop heart diseases than women. Okay, the causes of the heart valve disorders we'll study here. Okay, so there are number of causes for the different heart valve disorders. Causes may include birth defects, infective endocarditis, that means inflammation of the heart tissue. Endocarditis means the tissues of the internal tissues of the heart. Okay, their inflammation takes place and that is known as infective endocarditis. Okay, rheumatic fever, that means it is an inflammatory disease that brought on by group A streptococcal infection. Okay, there are various age related changes such as calcium deposits, heart attacks. Also all these are the causes, okay, that causes for heart valve disorder. Coronary artery diseases, that means I told you now that when the arteries they become narrower or it becomes harder, so thus atherosclerosis takes place and this develops coronary artery diseases. Cardiomyopathy, it is a degenerative changes in the heart muscle. Syphilis is a relatively rare sexually transmitted infection, so it is a STD. Okay, hypertension, this is also known as high blood pressure. Aortic aneurysms, that is an abnormal swelling or bulging of the aorta, which is the largest artery which is connected with the heart, directly connected with the heart. Okay, heart valve disorders, there are three types of disorders, three types of valve disorders. First is your mitral valve prolapse. We know that bicuspid valve is there. Bicuspid valve is also known as mitral valve. So when it prolapses, then that condition is known as mitral valve prolapse. This may also be called as floppy valve syndrome, click murmur syndrome, balloon mitral valve, or Barlow's syndrome. It occurs when the mitral valve does not close properly. That means when the bicuspid valve, it doesn't close properly, and sometimes it causes blood to flow back into the left auricle. Most people with mitral valve prolapse do not experience symptoms and do not require treatment as a result. There is another heart valve disorder, that is your valvular stenosis. This occurs when a valve is not able to open completely, which means that not enough blood is able to flow through the valve, and this can occur in any of the heart valves and may be caused by the heart valve thickening or stiffening. Okay, valvular regurgitation. Okay, this may also be called as leaky valve. That means it occurs when any of the heart valves do not close properly and causes blood to flow backward. Okay, now comes disorders of the circulatory system or the blood related disorders. First is your hypertension. An increase in blood pressure above normal level, that is above 150 to 110 mmHg of is known as hypertension. What are the effects that are responsible? Extremely high blood pressure of about 220 to 120 mmHg may cause rupturing of blood vessels of eyes that causes blindness. It can also cause nephritis, or you can say the kidney related problems. It can also cause a stroke or paralysis. Hypertension is often called a silent killer, as a person may suffer from it for several years without any symptoms. Okay, and what are the causes of the hypertension? Old age, arteriosclerosis, atherosclerosis. That means when the elasticity of the arteries becomes very low, it becomes the arteries become very hardened. Okay, vasoconstriction, excess weight, heavy smoking, intake of cholesterol rich diet, physical or emotional stress, increased secretion of renin, epinephrine and aldosterone. See, these are the causes of the hypertension. Okay, there is another term that is known as hypotension. Hypotension is just the opposite of hypertension. In hypotension, decrease in the blood pressure below the normal level takes place, that is below 100 to 50 mm of Hg. Okay, this is called as hypotension. Causes of hypotension are failure in neural and hormonal control, which adjusts the arterial diameters and precapillaries, sphincters, vasodilation, severe bleeding, diseases like TB, cancers, anemia, etc. Okay, this I told you that what are the causes of the high blood pressure. For most people, the causes of the high blood pressure is not known. This is known as essential or primary hypertension. But while the causes is not known, it is clear that various conditions and behaviors make high blood pressure more likely. Okay, and what are the known risk factors? So I told you, heavy smoking, being overweight, diet with a high salt intake, high blood pressure, family history of the high BP, high alcohol consumption, etc. Okay, so there are various things that causes hypertension: race, gender, genes, environmental factors such as inactivity, stress, obesity, tobacco, age, salt and alcohol. Okay, Now comes the second disorder. This is known as angina. Okay, angina pectoris. Okay, angina pectoris, it refers to the heaviness and the pain in the chest as a result reduced blood flow to the cardiac muscle due to narrowed and hardened coronary arteries. Person may also experience pain in neck, lower jaw, left arm and left shoulder. Okay, angina pectoris is often results due to over exertion, during which demand for oxygen by the heart cannot be met due to narrowed blood vessels, and the symptoms may disappear with the rest. Okay, so this, and it is very commonly seen among middle-aged and elderly people. Okay, so it is an acute chest pain, or it refers to the very heaviness and the pain in the chest as a result of reduced blood flow to the cardiac muscles due to narrowed and hardened coronary arteries. Okay, now comes CAD. What is CAD? CAD is a coronary heart disease or atherosclerosis. Okay, coronary artery disease, also called as atherosclerotic heart disease, which refers to the condition such as atherosclerosis that causes narrowing of coronary arteries that results in reduced blood flow to the heart. It is caused by the deposits of calcium, fat, cholesterol and fibrous tissues. This results in coronary heart disease, a condition in which heart muscles or the myocardium is damaged due to inadequate supply of blood. And depending on the degree of obstruction, symptoms may be mild chest pain, which we call it as angina pectoris, which we have just read, okay, just before CAD, or heart attack. Heart attack is known as myocardial infarction. Okay, and the removal of the blockage of an artery by balloon surgery is known as angioplasty. Okay, so what happens in CAD or atherosclerosis? See, these are the coronary arteries on the surface of the heart. These are the coronary arteries. This is a zoom view of the coronary artery. This is the normal coronary artery, and the normal blood flow is seen in it. Okay, but in this, due to deposition of the calcium and fat, cholesterol and fibrous tissue in the coronary arteries, see, these are the depositions of calcium, fat and cholesterol. So the vessel has become very narrowed. Okay, and this deposition is known as plaque. Okay, so this is known as plaque, and thus it causes the narrowing of the coronary arteries, results in the blood flow, reduced blood flow to the heart, and this results in coronary heart disease, a condition in which heart muscle or myocardium are the heart muscles, they are damaged due to the inadequate supply of blood, and depending on the degree of obstruction, how much the plaque is deposited, symptoms may be mild chest pain, which we call it as angina pectoris, or heart attack, which we call it in the scientific term as myocardial infarction. Okay, and sometime it is seen that these plaques, they cover the entire whole of the arteries. So removal of the blockage of an artery by balloon surgery is called as angioplasty. Okay, what it is called as? It is called as angioplasty. Okay, and always know one thing, that accumulation of such substances such as fatty substances, calcium or fibrous tissues and cholesterol, they they lead to the formation of atherosclerotic plaque. This is your plaque, okay, and this decreases the size of the lumen, arterial lumen, and thus it causes reduced blood flow to the artery, okay. And the removal of the blockage of an artery by the balloon surgery is known as angioplasty, okay. See, this is your normal artery in which the normal blood is flowing. This is the artery cross section, and this is when the plaque has deposited inside the arterial lumen, and this caused the narrowing of the artery and thus reduced blood flows. This is the cross section of the artery, CAD artery, that means coronary heart disease artery. In this, plaque has deposited and this has decreased the arterial lumen, and thus it reduced the blood flow of to the heart also, okay. Now comes heart failure. Heart failure is also known as congestive heart failure, okay. This is also known as congestive heart failure. It is generally defined as progressive weakening of the heart muscles and the failure of heart to pump blood effectively to meet the needs of body. Hypertension, it increases the amount of load on the heart. This results in significant enlargement of the heart, which finally results in heart failure. Heart failure is also called as congestive heart failure because congestion of the lungs is one of the main symptoms of this disease. Now, what are the factors that are responsible for the degeneration of the heart muscles and the heart failure? Include advanced age, malnutrition, chronic infections, toxins, severe anemia, or hyperthyroidism, okay. And heart failure is not the same as cardiac arrest. Cardiac arrest is when the heart stops beating, or the heart attack, when the heart muscles are suddenly damaged by an inadequate blood supply. So it should heart failure should not be confused with the cardiac arrest and the heart attack, okay. So this is a condition in which heart is not pumping blood enough to meet the needs of the body, okay. And this is the congestion of the lung is the major symptom of the congestive heart failure. Heart failure is not same as cardiac arrest. I am again repeating, and it is not same as that of heart attack, okay. So don't get confused heart failure with the cardiac arrest or heart attack, okay. Another disorders are stroke, aortic aneurysm, and arrhythmias, okay. Stroke, just as an interruption of blood flow to the heart causes heart attack, and interruption of blood flow to the brain causes stroke, and that is called as brain attack, okay. Now what comes is aortic aneurysm, an abnormal enlargement or the bulging of the wall of the aorta, which is the largest blood vessel in the body, okay. So that becomes very enlarged or bulgy, okay. Then that condition is known as aortic aneurysm. Now comes arrhythmias. This is the disorder of the heart rhythm that includes bradycardia, when heartbeats become very slow, tachycardia, when the heart beats too quickly, okay, and arterial fibrillation, and altogether irregular heartbeat. So these conditions are known as arrhythmias, okay. Now comes peripheral vascular disease. It is a progressive disorder that narrows blood vessels beyond the heart and brain and on the periphery or the extremities of the body, especially or primarily in the pelvis region, legs and arms, okay. So these were the disorders of the heart or blood related disorders. So thank you and keep watching Edupedia Word videos.